I've been saying for a while now, to mostly people that are around me and, that AI would transform the medical industry. I didn't see why it wouldn't. Um, but we have this article here. This article is titled AI Could Predict Patients' Future Health Conditions. Study finds the technology could be used to help doctors when it comes to monitoring patients or making decisions around diagnosis. I'll go further than that. I don't see why in the future, of course, people will have to give their permission, why patients wouldn't be able to say, hey, doc, or the doctor comes to them and say, hey, we have this new AI program that can monitor your health. They have it on their watch. Like I have my Samsung watch here, right? My Samsung watch. And, it tells you your blood pressure, your body weight, body fat percentage, body mass index. It gives you all that body mass index. I don't see why they wouldn't have something like this, maybe, and people wear it who are willing, and it monitors you, right? And then it lets you know, hey, listen, there's a problem. It's running this diagnosis on you. I don't know if that's realistic. I think it is. I don't think that's out of the realm of possibility. And then it alerts you, hey, you got an artery clogged. Hey, something's going on. I don't know the limitations of it, but I'm just putting this out there. And then you're able to get to the doctor, get to the hospital before something happens. That would be groundbreaking. But let's read this little tidbit. Let me read this little tidbit. Artificial intelligence could be used to predict the type of health conditions a patient is likely to develop in the future, a study has found. The technology could be used to help doctors when it comes to monitoring patients or making decisions around diagnosis, researchers said. The AI tool, known as Foresight, belongs to the same family of AI models as ChatGPT, but has been trained using information from NHS electronic records. It was developed by researchers from King's College London, University College London, King's College Hospital NHS, Foundation Trust and Guys, and St. Thomas NHS Foundation Trust. The researchers trained 3 different models of Foresight using data from more than 811,000 patients from 2 NHS trusts in London and a publicly available data set in the US. It was given 10 possible disorders a patient may experience next based on their records. When using the data from NHS hospitals, Foresight was able to correctly identify the conditions 68% and 76% of the time, which obviously in the future, as this gets better and better and more powerful, that percentage is probably going to increase dramatically. It says here, sort of like that AI that they had take the bar exam. It was like last year. And what did it get? Don't quote me on this. I'm just throwing numbers out there, but it was something like it scored a 65%. Then a few months later, after they improved it, it took it again. It scored a 78%. Like, look how fast the leaps are happening. I'm going to assume that it could be the same for this. Possible. It says it was accurate 88% of the time when using US data. Wow. Zelko Krajlik, research fellow in health informatics, biostatistics, and health informatics at KCL, and the first author of the study, published in the Lancet Digital Health, said the findings show the tool, quote, can achieve high levels of precision in predicting health trajectories of patients, demonstrating it could be a valuable tool to aid decision-making and inform clinical research. Senior author Richard Dobson, a professor of medical informatics at KCL and UCL, and theme lead for informatics at the National Institute for Health and Care Research, Maudsley Biomedical Research Center, that's a mouthful, holy smokes, said, quote, it is an exciting time for AI in healthcare. And to develop effective tools, we must ensure that we use appropriate data to train our models and work towards a shared purpose of supporting healthcare systems to support patients. I think the healthcare systems that we know of today are going to be very different in the future. I really do. And you know what? I'm not going to be able to get to it today, but I have this article about these AIs, these humanistic looking AIs. I mean, they don't look like robots. They look like people. And man, they're looking at doing some mind-blowing things with those humanistic robots, as they call them. I don't see why some of those would not end up inside your hospital. I just don't see why not. But I mean, in the future, of course, they're still under development. They're very advanced, but they still have a ways to go. But we shall see. So now that you have that information, folks, what are you going to do with it? I know what I'm going to do with it. And so until next time, take care.